Mm-mm. They've embalmed. It's okay. It's okay. It's okay. It's okay. It's okay. Once they've embalmed, that one is not. So what was the reason? He said there was no excuse. I mean, there was no space or what? Did he go with her there? I'll find out how much is the mortuary bill per day. My own mind, my own mind. He said he was going to find out and get back to me. Up till now, he has not. He has not got back to me. It's okay. No problem. We'll have to follow up with this because this one that they even promised now. You're not even sure whether. Uh, it's okay. It's okay. Okay. All right. So good afternoon, everyone. I'm Dr. John Abebe, the medical director of the Joje Fertility Center, and your uh, Fertility Forum, a monthly program where we talk about issues of fertility and how to overcome barrenness. I want to apologize most sincerely for certain factors was beyond our control. My sincere apologies. I believe that many of us have been waiting patiently online to connect. I'm glad that we are on to you. So today we're still going to be talking about the um, issues of um, infertility and how to um, begin the journey to parenthood, and most importantly, to talk about the process of IVF and what your chances are when the, the journey, when you start the journey at the Jabebe Fertility Center. Let me It's a fertility clinic that offers comprehensive fertility care to couples trying to get pregnant. We just entered the month of June. This is the 1st of June, and this is our anniversary month. The center will be 8 years this 22nd of June actually is the day we mark our anniversary. I want to say that it's been a great journey thus far. God has been faithful. We have seen hundreds of couples reached out to and barrenness destroyed. Such couples have become very proud parents, joyful parents. And I believe that those who are still waiting on the line, your time is now. So our clients having difficulty conceiving, um, these are the clients that we attend to at the Joje Fertility Center. Many come with many years of infertility, and the good news is that in spite of the number of years that you have waited, there is hope for you. And at the end of the day, you ultimately go on to have your babies. But a very important question that is often asked by our clients, which is what we've been looking at um, in this fertility forum, is what is my chance of IVF success at the center? Many of us have come to realize that the solution that God has made available, in vitro fertilization and embryo transfer, assisted reproductive technology have repositioned the management of infertility to such a position that now no no couple is barren. Why? Because we have the solution to practically every challenge that couples face. And so, in spite of the number of years you have waited, in spite of the diagnosis, particularly for the woman, we can practically say whatever it is that is the challenge that is confronting you. All right. So the question is, what is my chance of success at IVF? Because a lot of patients come with different um, medical background, and I want to say that your chance of success at the your chance of IVF success at the GW that depends on various factors. All right, and these factors are what we are going to be looking at. But I must say here that of all the factors that we'll be looking at, it's important for us to state categorically that the age of the woman is the most important factor that determines success at IVF. And that is why, again, I want to um, remind our couples out there, those who uh, gotten married and who are trusting God for the fruit of the womb, that there is no time to waste. That is the threshold for which we begin to see a significant um, decline in fertility for women is age 35. And a lot of women actually are getting married in their 30s these days, as opposed to our mothers when odds are already against couples when they are getting married now. And that is why there shouldn't be any delay at all. Once a couple gets married and the couple is up to 35 and above, 6 months after you're married, you should begin to consider very seriously the issues and make sure that you get pregnant as soon as possible. And for those who are less than 35, after 1 year of regular unprotected intercourse, and you are not yet pregnant, then one should begin to consider the go for evaluation to find out what the challenges are, and then begin to consider treatment. This is so very important because we see a lot of couples who waste a lot of time. All right, 1 year, 2 years, 5 years, and they've not really done anything. They're just waiting, and time is going. That is why I had to emphasize this issue of age as a very important factor that determines success. Not only does it determine fertility rate, even for couples generally, it also determines your success. at IVF. The all right. So as we go on about why age is the most age IVF success rate at the Joje Baby Fertility Center is 55.3%. And this was the rate we got last year into this year from our 2023 um, IVF season, right, at 53.5%. And that, although that is it's not, it's a good rating. We at this center, we're trying to see how we can further improve on the results that we've had before. So if we say 53.5% successful, that means that an average of 44.7% did not get pregnant. And so those that didn't get pregnant, many of them is as a result of different reasons. That is why we're looking at the factors that affect IVF success. So like we said before, age is the most important factor. Why? Because it determines or affects the quality and the quantity of eggs in the ovary. Quantity, embryo quality is a function of the quality of egg and sperm. That is why if the quality of the egg is poor, it will definitely affect the quality of the embryo, and that will go on to affect your chance of success. If you see the um, the table before us, chance of success based on age, you will realize that the, the younger a woman is, the higher her chance of having a successful pregnancy outcome and live birth rate. And the older a woman is, successful outcome. Like I said before, how age affects IVF success rate depends on one, the quality of egg and sperm. You know, the egg, the egg is one of the most, or the oocyte is one of the um, oldest um, cell in the body. The all the eggs in a woman are already produced by the time the woman is already 24 weeks in her mother's womb. All right, all the eggs are already produced, and so when she is born with a definite eggs or oocytes. By the time she gets to puberty, it has reduced to 400,000. When she gets to menopause, it's practically zero because every month a number is recruited, many of them die off, and then many and some are ovulated. All right. And so here you see the table that of age and quality of that determines this tells you how a woman fares when it has to do with her age vis-a-vis the quality of her egg. So you can see that the younger a woman is, the, the higher the quality of eggs that she has. And the quality of egg is a function of the percentage of DNA, normal DNA that that the egg has. Older, you have an increased rate of chromosomal abnormalities. And it is these chromosomal abnormalities that indeed does reduce the chance of implantation and having a successful IVF outcome. Okay, so apart from the quality of the egg and the quantity, how does the age also affect the IVF success rate? It also affects it by one, affecting the uterus and the endometrium. We have discovered that the older a woman is, the more the likelihood of developing things like uterine fibroids, um, adenomyosis, and polyps. They are all increased in women who are at an advanced age. There's also the risk of having a uterine scar because of multiple uterine fibroid surgeries. You see women who come to us for treatment who have had those women going through surgeries become a risk factor that affects the chance of success. But when you go through surgery, all right, there's the risk of additions, the risk of scars, and all of these does affect IVF success. All right. Apart from surgeries that increases the risk of scars, you also have things like of pregnancy and infections. All of these are all very common in women who are trying to get pregnant, and these factors go a long way to affect the chance of success. You see the picture that depicts the submucous fibroids. In this diagram, sub of success because it prevents implantation. Why we know that fibroid can affect chance of success, but it depends on the size, it depends on the location, the number of of the fibroid, because some patients who have fibroids do get pregnant and go on to have their babies, while a large number of them will require to have surgery before they can get pregnant. So you can see a scan report of the fibroid that was present, and afterwards, when the fibroid has been taken out, you can see this fibroid was a submucous fibroid. And you can see how the womb looks like, and the endometrium looking very nice after the fibroid has been removed. Next, you're seeing a submucous fibroid at hysteroscopy. All right, this has to be taken out. And then the next slide, you're seeing endometrial polyps. These are benign tissues growing right inside the womb in the endometrium. The presence of these will prevent implantation and then prevent a successful outcome. You can also see the scan showing a endometrial polyp. All right. And then the next slide is Asherman syndrome, when you have the walls of the uterus coming together. And then you have the next slide found in the muscle, the myometrium of the uterus. So all of these all go on to affect the chance of success. So when the woman comes for evaluation, these are the things that we would evaluate, we will check, and then we'll try and ensure that we have a, a good a good prospect for successful outcome. Okay, the other factors that also affect IVF success in terms of age, apart from affecting the egg quality and quantity, or affecting the uterus that will carry the baby, then it also increases the risk of medical conditions, because the older a woman is, the more likely she may develop medical conditions like hypertension, diabetes, and all of these can affect blood supply to the uterus and decrease endometrial receptivity. All right. Other factors that can affect egg quality apart from the age are things like polycystic ovarian disease syndrome, particularly when you have hyperandrogenism, high levels of androgens. They affect the quality of the eggs. And then, of course, you have hypothyroidism and multicystic. They have follicles that are arranged in the periphery of the ovaries. All right. So other factors that can affect IVF success include immunological factors, autoimmune, and factors that we consider, particularly when we don't, there are no, the embryo quality is very good, the womb is fine, there are no challenges, and yet we're not able to explain why a woman is not getting pregnant. Then we need to look at immunological factors. So other factors are lifestyle, smoking, alcohol. All of these affect sperm parameters. Okay. Also, for a couple who is trying to achieve pregnancy, will advise strongly that they stop this lifestyle, taking alcohol and smoking. And then, of course, endometriosis, endometrial fluid present can also be a very limiting factor for successful outcome. So how do you optimize your chance of IVF success? Number one, it requires, this is what we do at the Joje Fertility Center. We It requires individualized and personalized fertility care. All right, where you take note of the patient's peculiarities. Like I said before, I have mentioned different factors that do affect that fall to see how we can mitigate these factors and ensure that we optimize the chance of success. And this we do by a patient going through a very detailed fertility evaluation, and then you go through investigations to determine what, um, to be sure of what the factors are that are present that can affect success, and then we go ahead to ensure that those factors are taken care of. All right, and part of what we do to enhance or optimize success is to look at the various treatment options that are available. We try to make sure that patients going through IVF in our center, they go through the best treatment options. All right, we give you all the various options, and then we tell you what the prognosis are of each of the options, and will help you to pick option that will give you your best chance of success. All right. So, what are the solutions to the issues that we've talked about? Like I said before, one of the major factors is age. The age of the female, as it has to do with quality of egg and sperm. Now, while some other factors like use of supplements have been used to boost egg quality and quantity, all right, and some are very difficult to say how helpful these options have been, and that is why for couples who have issues with egg quality and the quantity, but because of age, the most viable option is the use of the third party. Third party means the egg donor. All right, that is the most viable option. It's a game changer. This is what has repositioned fertility treatment and has made it possible for couples who have even stopped menstruating to who are advanced in age in their 50s to still become pregnant and have their babies. All right. So that is that. Now it's also important for us also not to forget the sperm quality. Why we have talked a lot about the egg quality, because that is indeed the major factor, but sperm quality also does affect the quality of the embryo, although not to the same degree as the um, egg quality. All right. So it's important for us to also ensure that we place them on supplements, and then we also try to make sure that we enhance fertilization by doing intracellular sperm injection for patients who need it, to ensure that we optimize fertilization. All right. So the protocol at the Joje Fertility Center is that patients will go through the investigation, and based on the outcome of their investigations, there are pre-IVF treatments that will be carried out to optimize the patient before the start of their program. All right. Very good medical control is needed, particularly for patients who are hypertensive or diabetic. We want to make sure that they have, and then for patients who are hypertensive, we want to ensure that they are on safe antihypertensive. If the antihypertensive is not safe, then we will have to change the antihypertensive and then make sure that their blood sugar control is very good. All right, so we will go on a very short commercial break, and thereafter we will conclude this presentation, and then we will take questions. Okay, so we are back from our commercial break, and so we're talking about the factors to improve success. Okay, and then we've talked about the solution to air quality, sperm quality, the medical conditions, how to ensure we have good control. And then, to be more specific, in terms of improving egg quality, like I said before, the most viable option is to consider the use of the third party program. And this does significantly improve your chance of success, particularly for women who are very advanced. For women who are in their 40s, who are in their 50s, those who are in their 50s, I mean, who have already stopped seeing their period, there's really no option really. It has to be a third party. For those who are in their 40s, all right, the issue has to do with the quality of the eggs, because the experience has been that when we stimulate women who are in their 40s and we get eggs, the quality is not good at all, and it does affect the quality of the embryos and the chance of success. So imagine you're seeing a woman who is in her 40s, and because you are using a third party program, you are literally able to increase the chance of success from as low as 10-20% to as high as 50 to 60%. That is quite significant. All right. And then the other thing that we need to do to optimize IVF outcome is to improve beauty. And that you do by ensuring that all uterine abnormalities are dealt with. And then you also want to ensure that the environment is, is conducive for implantation to take place. And so what that means is that You want to ensure that if there's fibroids, if there are polyps, right, if there's infection, all of these things are all taken care of to ensure that you have a healthy environment. In spite of all this that may have been done, there are some patients who may not be able to carry pregnancies themselves because of very severely damaged um, uterus or the fact that they are not healthy enough. Pregnancy will become a very significant risk to their life. So for those categories of patients, surrogacy is a viable option for them to be able to have their babies. And I must say that a lot of couples are now embracing this method of treatment and they are having their dreams fulfilled. All right. So I want to say that overall, the chance of IVF success at the JFC is good. All right. So any couple willing to embrace the various IVF treatment options available has a very good chance of success. Now, it may require more than one cycle to achieve success. I know that a lot of our couples really desire to get pregnant in their first cycle. Whilst a lot of couples do get pregnant, remember that IVF is not 100%. All right, but I can assure you that with the number of more cycles that you do, your chance of getting pregnant increases significantly, and that is why our programs, we have one cycle, two cycles, and three cycle programs, just to be able to give you a package that is very cost effective and increases your chance of success. I want to say that faith and patience are required on this journey. All right, very required. It's not 100 meters dash; it's a marathon, and in marathon you must believe that you will get to the end, and you must be patient and endure. It's a very long race, but at the end of the day, you are there. You will end and achieve your results. I want to say that at the end, success program, and I eagerly look forward to saying congratulations, you made it. Well, babies, big congratulations. It's a day of celebration, which will happen to every one couple on the line for a miracle baby. Don't give up, don't despair, keep hope alive, because the God who has promised is able to save, and he says only that which remains. I'm a testament to the fact that God answers prayers. Over nine IVFs we did, over 6 years of treatment, waited for 13 journey that we went through. God has positioned us, and we're able to help those who are still. You will be rejoicing, and you would have become a proud parent. We look forward to having you start off your journey. Don't procrastinate. I know that the times are hard, it's difficult, but don't just believe God that God will make all the resources that you need available to start your journey, and by the grace of God, you will achieve success and end your journey in praise. God bless you and have a great weekend.
Covenant keeping God, I worship you today. Oh, oh, covenant keeping God. Covenant keeping God. never ever change. Covenant keeping God, you can never ever change. Covenant keeping God, I worship you today. Covenant keeping God, you can never ever change. Covenant keeping God, I worship you today. Covenant keeping God, you can never ever change. Covenant keeping God, I worship you today. Never ever change. Covenant keeping God, I worship you today. Covenant keeping God, you can never. Covenant keeping God, I worship you today. Covenant keeping God, I worship you today. God, I worship you today.
All right, so you're welcome back. I'm going to be taking some questions. We have quite a couple of them. So the first, I think some people have now gotten used to the fact that we do run promos on in June. June is our anniversary month. Well, it's a promo on a promo. Let me part of medications of our normal 2 years. The inflation, the inflation, such that a lot of things have really gone up, and we are trying very seriously to see how we can mitigate these effects on our costings, but it's been difficult. And so a lot of patients will notice that the prices of our prices have gone up. Painfully, it had to, because we just had to just meet up with it, and we have not even seen the end yet. All right. Currently, our regular rate goes from between 2.2, 2.3 to 2.93 million for one cycle. And so we have to 50% or initial anniversary promo that we've been doing for the past 2 or 3 years is to offer an addition to throw it open to the way we've done it before, where it's out for everybody. But what I can say is that for about 2 months ago, okay, and this is in spite of the very high rates of things. All right, we just felt that we should encourage our patients who have gone through this program at least once and are yet to be pregnant, to encourage them to continue on this journey. And I want to use this opportunity to appeal to a lot of our patients who already are on this journey not to give up. I know that things times may be hard, but just trust God that God will make provisions available. So that opportunity is still on, and many more. We started with a select few, but now we are opening the window to us to more people. All right. So if you are one of our patients, if you've not gotten any letter from us stating that you have been given that 10% discount, get in touch with us. But I also want to say that for the public of the foundation, the number is on the screen. You can give them a call from Monday because now they are not open over the weekends. The office is closed. But by Monday, give them a call. They will give you all the necessary support that is required to ensure that you begin your journey to parenthood. And then for those who can afford to pay the regular rate, because I realize that all fingers are not equal. Please wait. If God has blessed you and you can afford it, don't go for through the foundation. When we say we have a foundation and we are providing all of these significant discounts, many will say, "Oh, you are getting a lot of money from outside the country." The truth of the matter is that we are trusting God that the resources will come. All right, it's we are taking steps of faith to ensure that men and women are encouraged and that we ensure that we reduce significantly the burden of infertility. But we want to be able to reach out to different categories of people, and we believe God that as you take this step, that God will crown your effort with. So that is that about the promo, and then question. Someone good day, sir. Can someone that have done embryo transfer still experience menstrual cramps?